My name's Elaine. I did borderline personality disorder. So just to start, borderline personality disorder is a serious mental illness. It's characterized by pervasive instability in moods and interpersonal relationships, self-image, and behavior. It affects your family, your work career, one's identity and future plans, and like any type of relationship you may be in. Just some risk factors, which 2 times more women are actually likely to get this disorder over men. Some symptoms include impulsive aggression, depression, drug or alcohol abuse, distortion of thoughts, unstable relationships, like I said before, may have a sudden shift in family relationships, a shift in behaviors from good or bad. You could be happy one minute and sad the next. Highly sensitive to rejection of people telling you no, or rejection from schools and stuff like that. And then the fear of abandonment, which is a big part of it. A diagnosis is actually warranted when at least 5 of the following 9 criteria are present for 2 or more years, and they actually result in significant impairments. These are efforts to avoid abandonment, unstable relationships, identity disturbance, dangerous impulsivity, self-injury, which is a big thing, or suicidal behavior, affective instability, feelings of emptiness, anger regulation problems, and cognitive disturbances. Those are just a few of, you have to have at least 5 of those 9. And then just some causes. Although the cause is unknown, I'm going to pull this. Although the cause is unknown, genetics and environment actually do play a role and influence it. It's more common if your relatives have had it, you're more prone to getting it. And some borderline personality disorders have been reported of having a history of abuse, separation as a young child, or neglect. Now, my first article was the borderline personality diagnosis in adolescents, gender differences and stereotypes. So this experimental study was based on adolescent gender differences that influence the borderline personality disorder. It sees patterns of diverse gender and borderline personality. There's definitely patterns in it. In this study, they actually conducted 294 patients randomly described by clinicians, and they used the Q factor analysis to get the personality data on the females, and the results were crazy. Adolescent girls' symptoms are actually similar to adult symptoms. Adolescent boys are actually more aggressive with their borderline personality disorder, and they're more disruptive and more antisocial compared to females. There were actually 4 different subgroups for females in this study, and that were discovered. And it's histrionic, angry externalizing, depressive internalizing, and high functioning internalizing. So females are more internal than they are external compared to males in their symptoms and anger and stuff. So the next article I did was borderline personality disorder in adolescents, which all of them are in adolescents. This experimental study was based on the genetic, neurobiological, social cognitive, and biosocial theory behind borderline personality disorder. It was assessing adolescents early and treating them in the beginning can actually change their future outcomes of borderline personality disorder and reduce lifelong suffering. So it's very beneficial to diagnose early, but a lot of clinicians and stuff actually won't. And it discusses the influence of genetics to be about 40% for someone with borderline personality disorder. So having someone in your family can't influence you to have borderline personality disorder. It can be in your genes. The results of this study Many clinicians, like I said, were reluctant to diagnose people who were under the age of 18. Therefore, those kids aren't receiving the treatment that they need to help lifelong effects of this disorder. It can long-term affect your relationships and your academics. That's a big thing that it can do. And early diagnosis and treatment is a more chance of a positive future for these adolescents. Like I said, it can benefit you in many ways to from either having subtle symptoms to not getting as bad as what it could be. And the last study that I did was, I can't say this word either, phenomenology of borderline personality disorder, the role of race and socioeconomic status. This definitely does play a big role. In this evaluation, it focused on how socioeconomic status and your race can affect your borderline personality disorder. In the study, a total of 83 women with borderline personality disorder participated in this study. It was a cross-sectional study with 41 white women and 42 African American women. The interviews and questionnaires were captured. They captured internalizing and externalizing symptoms on the questionnaire. So the results, the white woman with borderline personality disorder reported more severe internalizing problems. And whereas African American women, they reported more severe externalizing symptoms. So white women were more likely to have their symptoms just internalized and keep it in, whereas African American women, they were like actually showing their symptoms and it was externalized. African American women show less suicidal behavior, but more anger compared to white women. They were always more angry. So then my overall summary of the articles. Each article discussed different treatments, which African American women with borderline personality disorder may present with more severe symptoms of lack of anger control. Like I had said, they are more likely to show more anger, and fewer suicidal behaviors than those of white women, like I had said, with borderline personality disorder, raising the possibility that they are misdiagnosed and receive treatments that are not optimal for borderline personality disorder. So therefore, they're more likely to receive treatment for like antisocial disorders and like aggressive disorders and stuff like that than they are for borderline personality disorder, which is what they actually have. Many clinicians continue to be reluctant to diagnose borderline personality disorder before age 18, like I had said before. A lot of adolescents are actually showing signs of borderline personality disorder, but are being diagnosed with other things and not getting the treatment that they need to help their future to not have it as severe. Therefore, adolescents will go undiagnosed, be misdiagnosed, and then get the incorrect treatment for their problem, and that definitely does not help them in the future and with their disorder. And then lastly of my summary, female patients are more internalizing and emotionally dramatic, and male patients more behaviorally disinhibited, excuse me, disinhibited, externalizing, and angry. So females are more internal and emotional, like a typical woman, and then men, they are more angry and aggressive towards other people in their responses to things. And the studies have showed that race, gender, and socioeconomic status really do affect your borderline personality disorder and how it's portrayed. Your coming from a low income place, that actually plays a big role. And the treatment that you can get, like I had said, the African American women and white women, they show completely different symptoms of the disorder compared to other races and all that kind of stuff. And the way it's externalized and internalized is really important. Same with your gender, your age, everything plays a big factor in your borderline personality disorder. Overall, the articles were very interesting. It's definitely interesting to see the stats between the fact that 2 times women are more likely to be diagnosed with this disorder than men is a crazy factor, and this has just been overall a very interesting topic. Okay, thank you.